The welfare history of Canada comes in four stages. The first stage was the early period, between 1840 to 1890. At this point in time, social welfare was a private matter and only consisted of caring for the mentally ill, the children, as well as ensuring that lawbreakers went to jail. The main contributors were women from the upper classes, private charities, and Catholic churches. Provincial governments began to support charities with grants. For example, the Ontario government distributed $12,000 among 16 charities. By 1890, the total amount was $77,000, distributed among 72 charities. In 1874, the Charity Aid Act was passed in Ontario. It consisted of funding being distributed according to the number of individuals in need. At this point in time, charities were separated into three groups: hospitals, poorhouses, and rescue homes. The second stage was the transitional phase, 1891 to 1940. In Ontario in 1914, the Workmen's Compensation Act was passed and was the first social insurance law passed in Canada. Because of the First World War, there was an increased demand of support for wounded soldiers and their affected families. In 1916, the first mother's allowance was introduced in Manitoba. Another event that helped make Canada a welfare state was the Great Depression. Under R.B. Bennett's government, the Dominion Unemployment Relief was legislated, and it provided provinces with grants to help the unemployed population. The Interventionist Phase, 1941 to 1974. In the Dominion Provincial Conference of 1945, Mackenzie King's government presented the Green Book proposals. This included social assistance and hospital insurance measures. This was a way to receive money from the provinces and income and corporation taxes. Under Louis Saint-Laurent's government, public housing, federal hospital grants, and assistance programs for disabled and blind persons were initiated. In 1971, Pierre Trudeau's government expanded the coverage of the unemployment insurance to include part-time workers. Last but not least is the austerity and constitutional conflict phase, 1975 to 2015. During this phase, the social spending cost was raised as a response to a number of social programs increasing. The quality of programs like child welfare also raised. This was because of the Canada Assistance Plan funding. In 1984, the Canada Health Act was passed, which prevented doctors from refusing to partake in Medicare.